certainly what motivates one child may not motivate another, but I think step one is figuring out what motivates your child. And so, because most kids are not really internally motivated to potty train, some are, but most kids need to be incentivized in some way. And so I think that that's important. Also, timing is key. I think if you try to push it too young, they're going to buck you, and in my experience, both with my own children and with my patients, I find that time period between about 2.5 and 3 is a real prime time that they're kind of open to it, but still young enough to be somewhat, pliable and compliant and all of those things. And so, so I think the timing is definitely key.
I have found that potty training has been one of the more challenging parenting aspects that I've gone through with my son. I agree with Dr. Moore. Timing really, really is important. And I find in clinic, most kids are potty trained around 3 years old, but I agree it's that 2.5 to 3-year-old age where a lot of kids really pick up on it. And there's multiple ways to potty train, and you'll talk to your friends, you'll talk to family, you'll talk to us, and everybody's going to recommend something a little bit different, but you know your child best. And as long as you can, find some sort of technique to pursue, let's go ahead and do that. We want to make sure that they're developmentally ready, like they can actually communicate to us as parents that they have a feeling, they have to go, they know where to go, what the toilet's for, they can actually pull down their pants to use the bathroom. So there's a lot more than just, an age and emotional type standpoint. We do need those like developmental skills as well. So sometimes if you start too early, they're just not quite ready. And then keep in mind too, that even after a child is potty trained completely, you're going to have setbacks. So randomly, you might go on vacation, or your child might be sick, or you might stay at the grandparents' house a couple of days or whatever. And then all of a sudden they're having accidents. Positive reinforcement is really, really important to keep in mind.
Consistency is key. And as far as that goes, that's hard when you're talking about, taking care of a child across multiple different environments. You just do the best you can. Whatever method you choose, whatever seems to be working for your child, just try to emulate that and keep it, in that other environment, and keep things as consistent as you can. And I think that's really important.